Hello. As someone who performs cervical screening tests, you must know how the samples are tested and what the results mean. Human papillomavirus, or HPV for short, is a common virus that infects men and women. In the majority of cases, your immune system will get rid of the virus, but in a proportion of people, this isn't the case. Even though HPV does not always cause cervical cancer, we know that more than 99 out of every 100 women who have confirmed cervical cancer are infected with HPV. HPV is passed on during sexual contact between heterosexual and same-sex partners. There are often no symptoms, and people can have it for years without knowing. In the past, cervical cells taken during a cervical smear were first examined under a microscope to look for abnormal cells. This is called cytology. Extensive research has now found that examining cervical cells for high-risk HPV is a better way of identifying women at risk of cervical cancer. This is called primary screening for HPV. The main benefit of primary HPV testing is that it is better at detecting high-grade cervical intraepithelial neoplasia, a type of precancerous cell change. This will identify more women at risk of developing cervical cancer. It also has a lower false negative rate. This means that less people will be told their cervical screening test is normal when it is actually abnormal. As a result, women may not need to come for screening as often in the future. The HPV primary screening pathway is for all women aged 25 to 64. Their cervical cell sample will initially be tested for high-risk HPV. If the test is negative, they will need routine screening in 3 or 5 years, depending on their age. If the test is positive for high-risk HPV, the cells will be examined under a microscope. This is called cytology. If the cells are normal, then the patient will be rescreened in 12 months. At this time, if their HPV status is negative, they will go back to routine recalls. If the cells are borderline or abnormal, the patient will be referred to colposcopy. This is an examination where a speculum is inserted into the vagina and the cervix is looked at with a microscope. For patients who need a repeat cervical screening test in 12 months, their sample will once again be tested for HPV. If HPV is detected, cytology will be performed. If cytology is normal, the patient will once again be rescreened in 12 months' time. If high-risk HPV is found 3 times in a row, regardless of whether the cells are normal or abnormal, the patient will be referred for colposcopy. This new programme of primary HPV screening must be understood by anyone who carries out cervical screening to ensure it is successfully implemented over the coming years. If you have any questions, please contact the Southwest Screening and Immunisation team.